Medicaid is underfunded, broken, and a poor system to finance care for children. And it is preventing children in every community from having access to care. And quite honestly, what Aetna offers, a pediatric office, rates below Medicaid, I don't blame them, because I would say, Dr. Rogel, what percentage of your practice is Medicaid? Oh, X percent? But you seem to be able to make money off of them. So why should I give you a dime more?
The truth of the matter is, with the Medicaid, you don't have any co-payments or deductibles or co-insurance. It's the card. Come in, they bill, they're done. With Aetna or whatever, there's a co-payment, and Mrs. Jones always gets mad about making that $25.
Yes. And when you look at what the Medicaid managed care companies, you're dealing again with a huge amount of the money going to administrative costs. That's just absurd.
But you get my point, right? When you're willing to take $50 for a service that should cost $150, it doesn't matter what business you are. If I'm Walmart and I'm buying 1 million widgets from you at $50, and then comes Target and says, I know that these are being sold at Walmart for $50. So they're paying you about $50 for it. Why do you want $150 from me? I don't get it. What is it that you're doing for me that I should pay 3 times what you're paying Walmart? And so we'll never win. We'll never be paid appropriately as long as Medicaid exists.
Correct. Unless it's folded into a Medicaid system as one system, and then you start dealing with a much larger group of physicians that are affected and are willing to put their necks out to try and change the system.
But even there, they passed this budget neutral law. And so every year we go through the same song and dance. We need to cut back physician payment by 3.5% to 4% this year in order to stay budget neutral.
A little less. It's 2.9%.
And then they dance and they he and they haw, and the AMA goes, the physicians won't take this. It's already hard to get a patient with Medicare. Medicare barely covers the cost of care. Our physicians are limiting the number of Medicare patients they see at Medicare rates, which is twice as much as what Virginia pays on the Medicaid side. And they go, okay, they figure a way, and they don't cut the reimbursement for this year. But next year they come back and we have the same dance.
Yeah.
And I don't know about you guys, but the people in this office that I help, they're nice people. They deserve a paycheck. They deserve to have a cost of living increase, because inflation has been 20% over the last 4 years. And they're having trouble buying eggs and chicken and steak at the supermarket for their families. And we don't get paid any more than we did 4 years ago. But inflation is 20% higher.
It's actually worse. If you look at most people's contracts, they haven't changed other than minimal changes in how payments are divided. The overall payments by insurance companies have not changed significantly since the time you signed your contract. And that can be anywhere from 5 years to 15 or 20 years. And even CINs, which were supposed to be able to do negotiations collectively, have failed.
And so people talk about a higher minimum wage and living wages for people. All great. I think, yes, people should be able to have a job that pays enough so that they can feed their family and have a roof over their heads. How am I supposed to treat my employees when I am not giving more money to give them those raises that they deserve and they need to survive? What impact does that have on my family, on my community?
The impact is end up with inferior quality of employees as well.
Yes. And the ones that work for you struggle to make
okay, literally double reimbursement than an office.
They have leverage.
And again, it's a matter of how the pie gets divided. We get a smaller and smaller portion each year. and their portion goes up and up each year. Look at what the proposed Medicare changes are for 2025. Well, it's budget neutral. If it goes down for physicians by 2.9%, it's going to go up over 3% for the hospitals. Which is still it's not enough to cover the changes in medical costs to begin with. But even that what they're doing is just shifting the cost, and it's shifting payments from one pile to another.
And the problem is that it's hard for people to understand. Healthcare is a local business.